Well, good afternoon. Yesterday, we passed two pieces of legislation with the support of all political parties, and I want to thank them, to provide job protective leave for workers and families affected by COVID-19. We also made sure families could buy the essentials they need by enabling businesses to receive deliveries 24/7 so they can keep their shelves stocked. More COVID-19 assessment centers are now online, and we now have 38 active and attending to patients. We have processed over 3,000 tests in the past 24 hours. We have now asked hospitals to only permit essential visitors. We're all working hard to get ahead of COVID-19, and thanks to our healthcare partners, we're moving forward. And now more than ever, we all need to thank our incredible frontline healthcare workers and first responders. Day after day, they show up and give everything to protect us. We're looking at ways to support them in their important work, and later today at Cabinet, we'll be discussing options to provide childcare for those frontline healthcare workers and first responders. We're also giving another hand up the parents. As a father myself, I know parents always want the best for their children. Ontario parents understand why schools and daycares are closed, to keep our kids safe and healthy and to slow the spread of COVID-19. But I also know from speaking to parents that they are concerned about ensuring their child can continue to learn while at home. That's why Minister Lecce and his ministry have been working hard over the past few days to deliver a solution. And today, we're launching the first stage of our Learn at Home education portal. This website provides countless resources and supports for at-home learning. All of these resources are high quality, made in Ontario, interactive learning tools in both English and French. They're in line with our grades K-12 curriculum and include a focus on the basics, so kids can practice their reading and writing and learn math and science skills. We will have certified tutors available through TVO to help students. As long as students have questions, the tutors will be there to answer them. We know a child's education is essential to their development, and we are supporting families through this situation to make sure our kids can continue to learn. This online portal is just one more way we're giving parents some peace of mind during this difficult time. And thank you to TVO, TFO, and Minister Lecce for your leadership in putting together some great resources for parents and kids. And I also want to thank all of the families who are doing their part to self-isolate while we work to slow the spread of COVID-19. Because it's absolutely critical, I repeat critical, that we are vigilant and take every step possible to slow the spread of this virus and prevent our healthcare system from being overwhelmed by a spike in the number of cases. We all need to do our part to flatten the curve. I want to remind everyone that washing your hands, staying at home where possible, and practicing social distancing is the best defense against this virus. That means no play dates for our kids, avoiding playgrounds, and using the drive-through or ordering delivery. We're all in this together, and we will all need to do our part. We will get through this. I'll hand things over to Minister Lecce to share more details about his ministry's important work.
Good afternoon, everyone. Bonjour tout le monde. I know that many parents and young people feel anxious about the road ahead. And I want you to know, to parents, students, educators, and workers alike, our #1 priority is your safety. The Premier has said it. We will do whatever it takes to keep you safe. This is our mission, And we are doing it in partnership with so many people and communities and first responders to protect our individuals and families from COVID-19. I also want to reassure students, parents, educators, and education workers that our entire team is working hard to ensure continuous service. Because one day, as the Premier said, we will overcome this adversity and this will end. And Ontario and Canada will emerge stronger and more united. In the meantime, we're actively working to bring stability to your child and family's life by providing innovative solutions to parents and students during this period of closure. Last week, immediately following the advice of Ontario's Chief Medical Officer of Health, the government issued an order to close all publicly funded schools until April 5th. It was to protect our kids, our staff, and our families. And on Tuesday, on the advice of Dr. David Williams, the Premier issued a declaration of emergency in the province. In the education sector, this means that childcare centres and private schools will remain closed. Now, the situation is quickly evolving, and I'm proud of the officials within the ministry, the frontline educators and administrators who are responding to this challenge. And that's why on Tuesday I announced that EQAO assessments, including the Ontario Secondary School Literacy Test for 2019-20, will have been cancelled this year. And in response, I've waived as a requirement for student graduating this year. So to be clear, no student will have their graduation compromised due to COVID-19. Learning must continue. Kids have access to curriculum-based materials developed by educators to keep students stimulated and motivated to learn. And I want to make sure that students have access to learning tools to keep their skills sharp. So today, as the Premier said, we are launching the first phase of Learn at Home. It is a new online resource that will help mitigate learning loss, provide interactive, teacher-led math supports, and empower all students to learn the key skills with an emphasis on STEM education. Learn at Home offers students high-quality, made-in-Ontario math and literacy resources that are created by Ontario-certified educators in both English and French. Elementary resources are designed to help young students learn at home with interactive activities. They're created to encourage participation through entertaining digital content. High school content will be developed with a focus on STEM education to ensure core competencies and skills are reinforced over this 2-week period. Our aim is to provide high school students with access to courses for students to review, to refresh, and to extend their learning through independent study. In fact, it is in times like these where digital learning tools demonstrate the greatest value. And for those students that do not have access to a computer, work is underway in real time in conjunction with our school boards to ensure the necessary technology is provided to everyone who needs it. In fact, earlier this week, my Deputy Minister and I held a call with directors of education where we urged them to work with us to achieve that aim. Right now, our government is focused on the immediate goal of preventing learning loss over the 2-week period following spring break. If Ontario's Chief Medical Officer of Health recommends closing schools beyond April 5th, the government will unveil a second phase of learning at home. This phase will incorporate a greater emphasis on online learning. Nous avons un plan pour tous les scénarios axés sur l'apprentissage. We're approaching the situation through an iterative lens. Ministry officials continue to engage with education stakeholders to see how we can continue to build on these resources and on online learning tools. We're consulting on programs such as virtual learning environments to see how we can expand learning opportunities for students right across Ontario. And I'll provide more updates as they become available in the coming days. I just want to take an opportunity as well to thank the teachers across the province who've gone above and beyond to help their students during this period. J'aimerais remercier nos enseignants et enseignantes pour leur travail ardu. I've heard amazing stories of teachers who have brought food to hungry students, who've checked in on sick students or students with ill family members, and who've provided reading materials and coursework to students. So to you, I say thank you for all that you've done and that you will continue to do to expand the knowledge of our students. Thank you so much.
Okay, we'll take questions. We're going to alternate between the floor and phone line today. So we'll start with Christina. 1 question, 1 follow-up.
Hi, Christine.
Hi, Premier. Hello. This question actually is for the Education Minister, if you don't mind, Minister Lecce. So, Minister, I know you said if the Medical Officer of Health recommends it, you will extend the school closure period beyond April the 5th.
Yes.
And we know, of course, in Alberta that the school closure is indefinite at this point. When do you think you will make that decision and notify us and parents and the public? And also, at this point, do you think the school year will be extended into July?
Yeah, no, I appreciate that parents want predictability. In fact, Minister Elliott and I were speaking about this just days ago. The aim is to continue the conversation with Dr. Williams to provide as much certainty to parents as possible. The determination will be based exclusively on the scientific and medical advice that comes to Cabinet when it comes to making sure that both our staff and our personnel in schools remain safe. That is our singular guiding principle, and I'll be sure to report to parents about the next steps. If we do have to go beyond the 2 weeks, I want parents to know with confidence that we will scale up and expand upon the first phase of the Learn at Home program to ensure it is more robust. And obviously, I look forward to engaging with a variety of partners, including the unions, over the coming days to see how we could better involve educators as part of the solution. I know many of them want to be part of a solution to learning during this period of unprecedented instability.
Okay, so the answer is you will continue to update. You don't have an idea as to when you'll make a decision.
The Chief Medical Health Officer will advise Cabinet. To date, he has advised us to the 5th of April. 4th of April. We've heeded that advice. Christine, if he asks us to extend that, we will do so without reservation.
Okay, thank you. For Health Minister Christine Elliott, please. Minister, yesterday we asked you if the criteria to attend an assessment center would be changing because up until about now, we have been hearing from people, you go through the online assessment and you can only visit an assessment center if you have traveled. As per the case of the 51-year-old man in Milton who died, his wife tells us at CTV News he was not tested for COVID-19 because he did not fit the criteria at the time, which specified foreign travel to any country with COVID-19 cases as a risk factor. His wife says he was basically dismissed because he had not traveled anywhere. Now, the City of Toronto on their website today are saying they're not focusing on travel anymore. They're focusing on those people who have the potential to infect large groups. I've asked them for clarification. They say it is up to the province. Can you clarify the criteria for people in this province to visit an assessment center, please?
Well, first I can tell you that Dr. Williams has been is speaking with Dr. Davila today about several issues, one of which will be with respect to the test centers. But we are asking people before they go to a test center to please be in touch either with telehealth, and we're working on getting the times, the wait times for a return call down. But people can certainly call their own family doctor and discuss their symptoms with them. They are now able to provide telephone advice, and I think that is the fastest way for people to get answers to their questions at this point.
Okay, question from the phone line.
Your question comes from Travis Bunrush of Global News. Please go ahead.
Good afternoon, Ministers and Premier. The question is for the Premier. California has ordered its nearly 40 million residents to stay at home. In Ontario, we know that the numbers are growing exponentially, yet the beer store, the LCBO, Dollarama, the Eaton Centre are all still open. At what point, Premier, do you say the province needs to be locked down?
Well, thanks for the question, Travis. I'm going to rely on the Chief Medical Officer of Health's advice, along with our COVID-19 command table, along with our health experts. And as soon as we get that advice, everything's on the table. I won't hesitate to shut anything and everything down once I get the advice from the COVID-19 command table and the Chief Medical Officer.
And this question is for the Health Minister. Yesterday, U.S. President Donald Trump said that they are having great success in the United States in treating COVID-19 patients with an anti-malaria medication called hydroxychloroquine, and they're stocking up on supply and fast-tracking deployment of that drug. Have there been discussions about that here in Ontario? Is that something that you're looking at and increasing supply?
Well, I know that we are looking at a variety of alternatives. I can't tell you that definitely we've been looking at that particular medication, but we are looking for every alternative to deal with COVID-19, and that the command table is looking at every possibility. So we will, following what President Trump has said, we'll certainly take a look at it. I don't know how effective it might be, but as the Premier said, everything's on the table. We're willing to look at anything right now.
Okay, back to the floor, Brian.
Premier, you said you're relying on the command table. I hate to go back to this question, but
Sure.
Previously we've had hours difference of everything's fine, 250 people are fine, keep going on your March break, keep restaurants open, and then hours later shut everything down. So is it wise to rely solely on the advice of medical professionals, or is it perhaps time for politicians to say, I'm going to take your advice, but I'm going to actually get ahead of this in a different way?
Well, thanks for the question, Brian. I'm a strong believer in the health professionals giving the advice. I'm first to tell you, I'm not a health professional, and we do have to take their advice, and we always discuss that advice that we get around the cabinet table as well, to make sure that that decision's the right decision. And so far, they've given us good advice. I do understand your concern and other people's when it goes from hour to hour, but in the case we're facing, it changes literally hour by hour.
And for the education minister, you made a reference to kids not losing their graduating year. Can you expand on that a bit? Tell us what's happening for kids that have already applied, perhaps been accepted to college, university for the fall. What will happen to them if the school year is canceled, if the delay just keeps them out longer?
Absolutely. The commitment the government is making is that due to the unprecedented nature of COVID-19, we're working to ensure that students continue to seamlessly able to apply and get into post-secondary education. We do not want to see impediments for graduation, nor do we want to further frustrate students who are, I think, dealing with a very anxious circumstance in their lives. So what I've done is we've canceled the assessments for EQAO for the remainder of the year. The literacy requirement is a graduation requirement generally. I've waived that. And obviously in the context of applications, I'm working with Minister Romano, the Minister of Colleges and Universities. We've reached out to various colleges and universities and their associations to ensure that there's a continued application process that doesn't get delayed, and that ultimately we work together to ensure students graduate in the province and get into post-secondary education. That will continue under our plan.
Okay, we'll move back to the phone line.
Your question comes from Matthew Simard from Radio Canada. Please go ahead.
Hi, my question is for the Premier. Quebec health officials said this morning they are looking at limiting interprovincial travel. They mentioned the border between Quebec and Ontario. Can you confirm that information? Is this something that you are looking into?
Well, I'll tell you what we're doing, Matthew. We're encouraging everyone not to travel. No interprovincial travel. We're encouraging people to stay at home when possible, work at home, limit the travel, and make sure we focus on social distancing. Keep 6 feet away from people, or 2 meters or further, and don't gather in large groups. So I think it's critical that we follow the advice of health professionals right across this province, and I really encourage people, do not travel.
But could you shut down the border between Quebec and Ontario?
No, we can't necessarily shut down a border that large. We're really relying, Matthew, on people, and 99.9% of the people are out there. They're working with us and working with the advice from the Chief Medical Officer. Everyone's doing their part. People are stepping up to the plate every single day. I'm getting endless phone calls of just average citizens helping out their neighbors or friends. The business community has absolutely been phenomenal in helping us in so many different areas, and is really a Team Canada approach. I'm in constant communications with the other premiers, along with our Deputy Prime Minister and Prime Minister. I want to thank them for the great job they're doing, but it's all hands on deck right now, and we'll make sure that we do everything possible to slow the spread and flatten the curve. I can't emphasize it enough. I always say, and you hear it over and over again, you can't wash your hands enough. Make sure that you don't gather with groups of large amounts of large people.
Okay, Cynthia?
Hello,
Hey,
Premier.
Cynthia.
Let's face it, schools are not going to be able to open in 2 weeks. Should parents be preparing for that inevitability now?
Well, I'm going to pass that over to our Minister of Education. I think everything's on the table to answer that question. I'd be prepared for pretty well anything. Our number one priority is to make sure our kids are safe and they stay healthy. Because if kids get it, they can pass it to their grandparents and parents. And again, we want to make sure we slow the spread. But I'll pass it over to the Minister.
Thank you, Premier. I mean, look, I think we are all very self-aware of the unprecedented nature and the speed of this pandemic. And the obligation, as the Premier made clear, and the Deputy Premier, is to keep people safe. That is the single foremost preoccupation of the government. However, while we're ensuring that by taking an unprecedented step, the first in the industrialized world to close schools, that's part of the decisive leadership, I think, being demonstrated, it's also a recognition of parents that we have a plan for the interim period for the next 2 weeks, and we will have a plan should Ontario's Chief Medical Health Officer expand that order for an additional 2 weeks or for the entire remainder of the semester. We have a plan to scale up learning, to help inspire young people to learn at home. And that's why I'm encouraging students and parents today to check out ontario.ca/learn at home. It is a central portal of knowledge. And based on the advice of Ontario Chief Medical Health Officer, we'll continue to build upon it, scale it up in both languages for all students in Ontario.
Thank you. And my follow-up for the Premier, please. Yes. Premier, people who with mortgages have the option to defer for 6 months, but 47% of Toronto residents, for example, are renters. So far, nothing has been announced to help renters out meet their rent. Are you considering anything like that?
Well, we're working hand in hand with the federal government on their stimulus package. Our Minister of Finance will be bringing his stimulus package out on Wednesday. But no one should be able to be kicked out of their home or their rental apartments based on not being able to pay the rent. It's just not going to happen. We won't allow it to happen. We have to make sure that we take care of the people. And I'll do whatever it takes to take care of the people of Ontario, take care of their health, take care of the economy, and make sure that they don't have these additional burdens on their backs, because it weighs tremendously on people, especially people that got laid off from their jobs. So I'll be making sure I have their back. If they can't pay rent, they aren't going to be evicted.
Okay, we'll move back to the phone line.
Your next question is from Alison Jones from the Canadian Press. Please go ahead.
Hi, Premier. I just want to follow up on a comment you made earlier about avoiding playgrounds. We've seen a little bit of conflicting information about playgrounds, and various municipalities are doing various things. Some are putting up signs at playgrounds, essentially saying they're closed. Is that something you think should be happening province-wide?
Well, I think, again, we have to rely on the common sense of people out there, and everyone's really cooperating. Everyone's working with the government, taking the advice of the Chief Medical Officer. I'm so proud of the people of Ontario right now for supporting the advice from the medical professionals and the government. And we just need to be vigilant to every step of the way. This is the only way we're going to be able to slow the spread, and working together. The government of Ontario, the government of Canada, we're always going to be there for you. But the people have to be involved. The 444 municipalities, the 14.5 million people in our province have to do their part, and they are doing their part in so many different ways. So just ask for cooperation and limit the exposure to this virus by staying at home, staying in your backyard. I know it's tough, very tough on people. When you can stay at home, please just stay at home. Thank you.
Okay, and for Minister Elliott, just hoping you can comment on the 4 cases we've seen at a long-term care home in Durham. What do we know about that, and how concerning is that for you?
Well, it is very concerning because, of course, most of the residents in long-term care homes are very vulnerable. Physically, many have other physical conditions that would allow them to be very compromised should they catch COVID-19. So our public health officials are there now. They are thoroughly investigating the situation, contacting first of all, the families of the people who have contracted COVID-19, finding out if any of them have COVID-19 symptoms, if they've been traveling, try to find the source of this so that we can make sure that none of the other residents are going to be compromised. We do take this very seriously, and this is under very active investigation.
Hi, Minister Elliott. My questions are for you, so stay up there.
Okay.
So the rate of increase of the infections today, 50 new cases. Over the course of the past week, the daily increase in infections has been ticking along at on average is 22%. How concerned should people be of the rate of growth in new infections over the past week?
Well, as Dr. Williams said yesterday, he's not entirely surprised that the rate of infections have increased at the rate that they have, given that we have asked all of people to come home. If they've been living abroad or traveling abroad, there's a lot of snowbirds that are coming back, mostly from the United States. We've also got families that are returning from March break vacations. So it's not surprising that we would see that uptake. However, we are watching that very carefully to determine what else we might anticipate in the future. But we are also gearing up at our command table as well to deal with the increase in these number of cases. We have additional equipment coming in, more ventilators and so on, so that we're prepared for an increase. But I think what we're seeing very recently is due to people returning home.
Okay, my follow-up was actually about you mentioned the ventilators.
Yes.
I just spoke to an ICU doctor who said it's great that the province is bringing in 300 new ventilators, but there's only so many ICU doctors in the province. What is the Ministry of Health doing to help ramp up the capacity of healthcare workers to care for people in the ICU? So both ICU trained nurses and doctors who could help out in the ICUs.
Well, that is something that the command table is actively considering. However, the bigger issue at this point seems to be the availability of the ventilators, not the health human resources. That being said, we did receive a shipment of 300 new ventilators in addition to the extra over 200 that we already had that are not already in use in our hospitals. And we are also looking for Ontario producers to be able to make more ventilators here in Ontario. And we have also received offers of assistance from other physicians, from dentists and so on, who may have ventilators in their practice that they aren't using because they've closed down most of the dental practices now, as well as some of the other practices that have the ventilators, that they're able to loan them to us. So we're receiving daily offers of assistance for more equipment. So we are building up our capacity quite considerably.
Okay, this will be last question, Mike.
Premier, yesterday you talked about eviction orders being suspended. We've received some calls from people who've been told by their landlords they have to pay their rent on time, and then follow up with the tenant board saying that it's absolutely not true. They say they're being told by the tenant board that evictions are being suspended. Can you clarify this?
Well, I want to make it very clear to people that if you have a job and you pay the rent, pay the rent. That's the right thing to do. If you've been laid off and you can't pay the rent, no one's going to get evicted. I respect the landlords. They have a business, but we're in unusual times right now. And my job as Premier is always to protect the people. And I'm going to do what it takes to protect the people. We're going to get through this. The landlords will get through it. But some people are going to face some tough times. But it doesn't give a free pass for people just to say they aren't paying. Be responsible. Pay if you can. But if you're down and out, you just don't have the money. Food's more important to put on the table than pay rent, then put the food on the table. If you need medical help or you're spending money on essential services, make sure that's a priority. We will make sure that they're protected. And it's a message to the landlords. I appreciate the job and the investment they put in, and I appreciate them contributing. But we're going to take care of the people of Ontario at all cost. Thank you, everyone, for today. Thank you.
Yeah.
Premier, quick question on
Yes.
the passing of Claude Bennett, PC stalwart, former cabinet minister, passed away last night from a heart attack.
Yeah, my heart and prayers go out to their family. I'll be calling Bennett family. I have their number, and I just this time it's heartbreaking. He was a great member of our party. He worked endlessly, him and his family, and my heart just goes out to him. Thank you.
Premier Mike has just one last question here.
Yes,
Yes,
Mike.
and Premier, maybe even the Health Minister may want to comment on this. Right now in downtown Toronto, we're seeing hundreds of people lined up outside in a video game store for the launch of some new video games. Here we're talking about social distancing, but at this time of uncertainty, people are still being close. Should there be any repercussions either to the store or to the people who are not practicing social distancing like this?
I'll take this answer. It's unacceptable. Guys, the young people, please, do not get in line, practice social distancing. It's unacceptable. This is exactly what causes the spread. When people gather and they're in close proximity to each other, I just can't stress it enough. And if you're a parent and you know your child's going down there, don't let them go down. It's frustrating when I hear stories like this. I just can't stress it enough. Do not do that. And I'm frustrated, to be very frank, with the store owner that would allow this to happen. They have a responsibility. Everyone in this province has a responsibility to make sure we protect each other. And I'm very, very disappointed with the store owner that would do this.
And on that note, should they be fined, the store owner?
Well, again, we'll look into it. We'll send over someone there to speak to him, bylaw officers, police. But isn't it a shame that we have to go to this degree when we just over and over emphasize not to do this, and some people ignore the advice? You're putting everyone else into danger. Please do not create these environments out there. And thank you for the question on that.
Thank you.
Thank you.
Thank you, everybody.